It's really common for patients to have some degree of regret after surgery in that first 2-week period. The first 2 weeks universally are a challenge. Personally, I think our office does a lot of things really well when it comes to taking care of the surgical patient. I would say one thing that we emphasize a lot during the surgical consultation and during the post-operative healing phase is how much of an emotional roller coaster surgery is. I tell patients that rarely you are actually watching a surgical field heal. For instance, if you get your gallbladder removed, all you see are the little laparoscopic holes with the Band-Aids over them. You're not actually watching like the stump of where your gallbladder used to live heal. With the face, we are actually watching every stage of healing, which can be a real struggle. You can't hide it like other areas when you have surgery. And then some areas may tend to accumulate more swelling fluid than others, which you can say like, why am I more swollen here? We actually have a handout that I give all patients during their surgical consultation with us. I have it pulled up on my computer. And the title of the document is Cosmetic Surgery on the Face Can Be a Bit of an Emotional Roller Coaster. You have become familiar with your appearance over the last several years. Things that you love about your face, things that you don't love so much. It's what you see when you look in the mirror. Cosmetic facial surgery is unique in that we are altering you in a way. Almost universally, you start to feel a little down, especially the first week after surgery, and this can last for several days or a couple weeks. During the emotional recovery, patients can have questions like, did I make the right decision? What am I going to look like once I'm healed? And when am I going to start to feel like myself again? Common feelings during this phase, feeling down, depressed, and blue. Lots of questioning, frustration with the healing process. Our entire team, me, our nurses, our whole clinical staff, we are here with you that entire time. Our surgery patients are able to call, text me any time of the day. And I think just knowing that they can call me or text me is reassurance enough. That being said, if someone's having a really down night or down day, I always tell them to call or text us and they can come in. We can double check everything. We can chat with them. We can show them their interval progress. Oftentimes they don't feel like they're making any progress, but if it's been a couple days since we've seen them, we can definitely tell an improvement, especially in terms of their swelling. Some suggestions of things that you can do as a patient when you're in that first 2 weeks of really feeling not great. Reaching out to our team with questions, that's what we're here for. I'm reading off our document. Going for a light walk outside. I think that getting fresh air and just being outdoors can really help your kind of your soul. Diving into a good movie or a good podcast to try to get your mind off of things. Catching up with a good friend over the phone, probably not FaceTime, but more just an audio call. Trying not to fixate on the little tiny things and trying to stay back and look at the forest view. And then surrounding yourself with a really supportive and uplifting support system. Those are the little things that can make a big difference. But for the first 2 weeks, I tell patients just stick with me for 2 weeks, and then you're going to start to see the light at the end of the tunnel.